Hi, my name is Colin Spence. I am a PharmD and clinical research coordinator here at Quality Medical Research, a subsidiary of Digestive Health and Liver Specialists.
Colin, for people who don't know, what is fatty liver disease and what is NASH?
So, fatty liver disease is just like it sounds. It is where fat infiltrates the liver tissue. NASH is a consequence of fatty liver disease. That is when you have fat in the liver, and then additionally, you start to have inflammation.
How do people get NASH and how common is it?
So, primarily, when people get fatty liver and then NASH, it is caused by what is called metabolic dysfunction in the body. That is going to be things like high blood pressure, poor control of blood sugar, and result of diabetes, cholesterol, and predominantly patients who are overweight are more likely to end up with fatty liver disease and then NASH. And usually the underlying cause is a genetic component. Some people's bodies just metabolize fat differently, and they are at a higher risk of getting NASH.
How do people know if they have NASH?
So there are a number of tests in labs that can be run that would tell your doctor if you have fatty liver disease and NASH. Things like liver enzymes would be elevated, for example. Some people will present with symptoms. Some people may have sort of abdominal discomfort in what's called your right upper quadrant. Other people may experience fatigue, weakness, things like that. The brunt of the serious symptoms usually emerge when you have cirrhosis due to NASH, which it absolutely can cause. NASH can lead to cirrhosis, and then, if not treated decisively, cirrhosis can lead to something called HCC. But by the time people have cirrhosis, they may notice things like jaundice, which is yellowing of the skin and the eyes, things like that, as well as distension of the abdomen and extreme abdominal pain.
How exactly is it treated then?
So, NASH is treated for a long time. It's been treated by primarily diet and exercise. So you get rid of it the same way you got it. That means tighter control of blood sugar, better management of hypertension, optimization of the treatment of the cholesterol, and then weight loss is a huge component of treating it. Until very recently, there was not an FDA-approved treatment for NASH, nothing you could take medication-wise. We are now exploring different modalities that can change that. At this clinic in particular, we have some clinical trials that are looking at oral medications that can treat MASH. So it's very exciting because that's not something we have seen up until now in the management of this disease.
Why is it important for people to know about NASH?
It's important for people to know about NASH because it's very prevalent. Something like 24% of Americans have fatty liver disease, and of that 24, a big proportion, something like 20%, will go on to develop NASH. I think that constitutes something like 2 to 5% of Americans overall. NASH is reversible, and so is fatty liver disease. However, if NASH is not treated, promptly or effectively, it can actually go on to cause cirrhosis. Cirrhosis is not reversible. And like I alluded to earlier, cirrhosis can lead to something called HCC, which is hepatocellular carcinoma, which is liver cancer, essentially. At that point, your only recourse is transplantation. NASH is the leading cause of liver transplantation in women, and it is projected to be the leading cause of liver transplantation overall by the year 2030. So it's more prevalent than people might think and actually has some fairly serious consequences.
Thank you.